Hello, my name is Dr. Diwan S. Raja. Today I will discuss about triangle of auscultation. The triangle of auscultation is a small anatomical area on the back where doctors can listen to lung sounds more clearly due to a thinner muscle layer. This triangular area is bounded by the following: medial border by the inferolateral border of the trapezius muscle, lateral border by the medial border of the scapula, inferior border by the superior border of the latissimus dorsi muscle. So we got the boundary. Now we'll go to the floor. Boundary again by the medial border of the scapula, the inferolateral border of the trapezius, the superior border of the of the latissimus dorsi. Okay. The floor of the triangle of auscultation is formed by the seventh rib, sixth and seventh intercostal spaces, and rhomboid major muscle. Okay. This is the triangle of auscultation. This is another one is here. And bounded by the trapezius here. This is the trapezius muscle, medial border of the scapula, and upper border of the latissimus dorsi muscle. Okay, so this is the trapezius, latissimus dorsi, medial border of the scapula. Boundary of the triangle auscultation floor is formed by the seventh rib, sixth, and seventh intercostal space. The triangle of auscultation is a gap in the thick back musculature and is a good place to examine posterior segments of the lungs with a stethoscope. When the scapula is drawn forward by folding the arm across the thorax and the trunk is flexed, the auscultatory triangle enlarges. And that's all about the triangle of auscultation. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.